Less than 1% of students are using Colorado's free COVID testing program in schools. That is not a lot of bang for $170 million of our bucks. Mark Salinger asked the governor if that is money well spent. The governor told Mark he wishes he could use it elsewhere.
I want you to complete this sentence.
More than a month after it started, Colorado's school COVID testing program isn't working the way it was designed, at least not yet.
We're currently at 571 schools. Last week we tested about 5,000 students on a weekly cadence. That's up from 4,000 the week before.
5,000 students isn't a whole lot, considering there are more than 883,000 in the state. That means about half of 1% of all students in Colorado got a COVID test last week through a program the state is spending $173 million worth of federal funding on. I asked the governor about it today after he got his flu shot in front of the cameras.
Will you continue to fund it with $170 million even though only 1% of the students are actually participating in it?
Well, again, when the federal government offers us money, we like to deploy it. I wish we could repurpose it for other purposes, including additional work around vaccination. But look, the vaccination work is well-resourced, so we're not wanting for resources there.
Governor Polis has even offered incentives to try and kickstart the program. Maybe the price is too low.
We had wanted to offer more. The federal government allowed us to offer $15. We thought if we were offering $30, $40, $50, we would have more, and we probably would. We would have more students, there's no question.
It's not the first time incentives have been offered to help battle the pandemic. Remember the vaccine lottery? A new study from CU Denver found those incentives didn't convince people to sign up either. But now it's not just a lack of students signing up that have some schools frustrated.
We signed up early September. I believe it was the first week of September.
Brian Hill is the assistant superintendent at Mesa County Valley School District 51. His district planned to use the program to offer regular rapid testing for students, but still hasn't received the majority of tests or the link for parents to give permission to students.
Last year, we were the largest district in the state to open in person and stay in person, and so we wanted to continue that obviously this year as well. And this is going to be a big key to that.
I wanted to know what percentage of students would need to get tested at any given school to make the program successful. I spoke with Dr. Glenn Mays at the Colorado School of Public Health, who says the more the better, of course. 20 to 25% would be good, but the reality is that if you don't get enough students to get tested, the test room program trial misses so many more cases than it actually finds.
So I think, Mark, I might have assumed that maybe districts just decided that they didn't want to participate in this testing, but there were some that really wanted to make it work and felt like they couldn't.
Yeah, I spoke to a school district up in Greeley today who says that they wanted to sign up for it. They were in the process of getting everything started, and then their staff realized how much trouble it would be, how long it would take the staff to actually do the testing and do the data and track everything, and they backed out in the last couple of days.
Mark Salinger, thank you very much.